Welcome to today's Global Connections program. I'm Bill Miller. Today we're going to be talking about COVID-19, a disease that's ravaged the world for the past year and a half. My guest is an expert on this topic. Dr. Salvador Macip is a doctor, researcher, and writer. He is the head of the Mechanisms of Aging and Cancer Lab at the University of Leicester in the United Kingdom. His latest book, of literally a myriad of books he's written over the years, is titled Modern Epidemics, from the Spanish Flu to COVID-19. Dr. Macip, welcome to today's Global Connections program.
It's a pleasure to be here.
I appreciate you being with me today. Your book couldn't be more timely. I mean, there are timely books and there are really timely books, and yours is right up there at the top of the list. Why did you decide to write this? A lot of people have written on this horrific disease that's ravaged the world, really. But why did you decide to write this book?
Well, this has a bit of a long story because the first version of this book was written 10 years ago when the pandemic of the flu, 2009 flu was going through the world. And I ended the book saying, we need to be ready for the next one because it is not just the last pandemic, there's going to be more pandemics. And when this pandemic started, my editor said, we need to publish this book again. The book is still relevant today. And what I did is I added a whole bunch of chapters on COVID. So it's a book that was written 10 years ago, and it's been now updated to include everything that's been happening now.
Mm-hmm. And of course, it's been a fast-breaking flu. What, as you think back to November, I guess, of 2019, December of 2019, and certainly into January, February, and March of 2020, how do you feel that the countries of the world responded to this? I know there was a lot of misinformation, maybe no information in many cases, but how did they respond?
I think it's a mix bag, the response. I mean, there's been some countries that really did a good job. Some didn't. As an average, I think, if we look at it from the global perspective, as a worldwide perspective, I think we did poorly because pandemics are problems that hit everybody. So it's not just China, it's not just the US, it's everybody that's suffering the pandemic. And therefore, the response should be better coordinated. It should be everybody together, working together to try to stop this. And there's been a combination of things happening, like in this pandemic, like in many other pandemics, is the same thing. So when it starts, people are not sure what's going on. Perhaps even the government wants to hide it because nobody likes the pandemic starting in their territory. And then it takes a bit longer to reach the scientists. And then the response may not be as swift as you would like. And the whole thing adds up. And the problem is that every minute we lose in a pandemic, you're losing lives as well. So you count all the mistakes you do, you count them in lives lost. And I think that is something that we should learn from this pandemic. I mean, I think there's going to be more pandemics for sure in the future. And I think that's the most important thing now. It's to look back and say, okay, how could we have it done better? How is this, how can we improve it? Where did we fail? And I think there's many places where definitely things can be better. I think the first thing I would look for is coordination, better coordination, definitely among countries.
That's a very important point. I mean, we may as well start there. I just saw a report the other day, and maybe it's been out for a while, I'm not sure, but the countries that apparently performed the best were countries like South Korea, Taiwan, New Zealand, different ones like that. The worst performers were Mexico, Brazil, the United States, and Belarus. So we're at two extremes there. So what can we do to prepare better? International coordination is absolutely critical. And we'll talk about really the only group that can do it is the UN World Health Organization. I know it's got some problems, but it certainly has had a lot of strengths over the past several years. But what can we do to prepare for the next one?
Yeah, I think first thing, the most important thing is vigilance. You have to be aware. You have to be on the lookout all the time because viruses jump from animals to people all the time. And we need to see where that happens. And sometimes it jumps and nothing really happens. That's not a problem. It's just perhaps a small outbreak or perhaps even a couple of cases. That's fine. But we need to be aware of those. And this needs to be publicized properly and investigated properly because one of them has the potential to become a pandemic like this one. Sometimes it doesn't get to that point, like the SARS epidemic at the beginning of the century. It looked like it was going to be a pandemic, but it didn't. But you have to follow these things very closely. And the only way is to be aware of what's going on in the world. I think one of the issues we have now in this sort of modern era is that we are invading the habitats of animals more and more. We're destroying the habitats, and we are in touch with animals that should not be in touch with humans. And bats, for instance, bats are these animals that they harbor lots of viruses, and they're okay with them. But when these viruses jump to humans through perhaps sometime an intermediate animal, then we can have problems. So we need to be aware of this. Are we destroying habitats? Are we invading habitats of animals? Where is the next one going to jump? How quickly can we detect them? Can we set up like organizations, networks that can check the hotspots? Because there are areas in the world where you could expect this more often. So can we just keep vigilant about these things? Can we raise the alarm quick enough, fast enough to respond to this quickly? Can we forget all this stupid pride that sometimes nations have that complicate things? I think it comes back to what you were saying. Maybe perhaps we need to give more power to the UN, to the WHO, some organism that is above all countries, that can coordinate, can put these wheels in motion in a better way than instead of leaving everything for each country to decide on their own, which is what we did now. And sometimes it works, sometimes it doesn't. That's the problem.
Mm-hmm. That's a very good point about the World Health Organization. When I think back to WHO, I remember it was smallpox, as I recall, from 1967 through about 1980, did a remarkable job eliminating smallpox. It's teamed up with Rotary International and the UN Children's Fund and the Centers for Disease Control to eliminate the scourge of polio. But WHO had, well, there were some complaints about it in this one, but it seemed to me, and I may be wrong, just reading the newspapers and what have you, it still responded as it got the information. And the WHO is limited. It's not a one world body. It can't go into China and say, give us the information in Wuhan, we want it, and we'll walk out with it. It doesn't work like that, does it?
Yeah, no, absolutely. You're right. I mean, the WHO doesn't have actual power. It's a consulting body, but it cannot actually act on these decisions. And I think that that's definitely a problem. And we saw it in the past years when President Trump decided to pull out of the WHO. I mean, that's an example of how the WHO doesn't then, it loses the ability to do things. If a country gets upset, could be China, could be the US, could be anybody. If you are, for whatever reason, that country perceives that you're going against something, some national interest, they can just pull out and the whole thing collapses. And it's very difficult to find a way that the countries are going to give some power back to an organism that can oversee them all. I mean, the UN is a bit like that, but the UN also has its problems. And I agree with you that the WHO is not perfect by any means, and the UN is not perfect at all. And the WHO made mistakes in this pandemic and in previous pandemics, but it's the best we have so far. I mean, whether we need to improve it, we need to revamp it, we need to create a new organism, I don't know, but we need something. And at this point, what we have is the UN and the WHO. And I think the WHO at least did something very interesting the past weeks, which is actually do an internal audit to try to see what went wrong. What did they do wrong? Nobody has done this yet. I mean, I think all countries should do that. Every country should look at themselves and say, okay, where did we go wrong? At what point did we start doing things not the right way? And at least the WHO admitted, okay, we could have done better, this, and that. And I think that's key, because I mean, this is a serious pandemic, it's a serious crisis, but it's not the last crisis we're going to have. It's not the last crisis we're going to have to face as a worldwide population. So let's start looking ahead as well. The problem is that at this point, nobody wants to look at the next pandemic. We're still suffering this one, so nobody wants to think, okay, what we're going to do next. But that's exactly what we need to start doing now if we want to do a better job next time. And whether that it's empowering the WHO or finding a new way to create another organism that everybody agrees with, I don't know. But definitely, I think steps like that should be taken in consideration, yeah.
Or all of the above. I think you're absolutely right. We really need to do that. I was just talking to a staff member last week, a member of Congress in Washington, and we were talking about the withdrawal from these UN agencies in particular under the Trump administration. This is a little bit off the topic, but we came to the conclusion that anytime you withdraw from an agency, you leave a political vacuum. And somebody will fill that vacuum. And it doesn't matter if it's the Human Rights Council at the UN or the WHO, or it could be any agency. Somebody will fill it. And normally it won't be your friend who's going to fill it. And in this case, China was more than happy to fill in when the United States moved itself to the sidelines. So it damaged the United States. It weakened the United States argument, and it weakened WHO, because as you mentioned, all the countries of the world have to participate in this. It's just like mass immunization. There are almost 8 billion people on the planet. We have to immunize all 8 billion, or we will never be safe, will we?
Absolutely, that's the whole point, and I think that's another whole debate that's starting now, because now every country is going at it on their own. So, I mean, we are putting ourselves first. I mean, and in Europe, we used to criticize President Trump's slogan, America first, but that's exactly what we're doing in Europe as well when it comes to vaccines. And it's exactly what you say. This is a worldwide problem. This 8 billion people that you have to vaccinate, and that's how it is. I mean, you cannot go at it to say, okay, my country is back fully vaccinated, I'm fine. No, you're not. As long as the virus is running free somewhere in the world, you're not safe. And that's important to keep in mind, because this virus mutates. All viruses, as they circulate, as they jump from people to people, they would mutate, they would change. And there's always the risk that a new variant, a new strain may emerge that may be resistant to antibodies, may be more aggressive, whatever. But it's what we're seeing right now in the UK. In the UK, we were probably one of the countries with the best numbers, best figures right now, with very low cases numbers and almost no deaths. All of a sudden, we got this Delta variant, the one that started in India, and everything is starting again. And we were fully vaccinated. That was perfectly fine, but India is not. And as long as you have a country, India, Brazil, whatever, when the virus is running free, this is going to come back to bite you. And this is very important that we don't really see that. And we say, okay, as long as my people are vaccinated, it's fine. And I think we need to try to be less selfish about it, because in the end, being selfish is also bad for you, because you are going to get the problems as well. That this virus is going to come back to you. And I agree with you. This has to be a worldwide leadership that drives this sort of global effort for diseases like this. And I think the US, obviously, as one of the biggest and more powerful countries in the world, has to step up and and lead these things. It cannot step out of actually these programs. It's the opposite, because as you say, if you don't lead, somebody else will. And I think that you cannot afford, as a powerful country, to be out of things like this. And I think we'll lose track of how important it is, coordination and global efforts in this world. We think about things more about the competition. I'm competing against China and competing against Europe. And even within Europe, the UK is competing against the rest of Europe because of the Brexit and everything. That's not the issue. I mean, if the UK is suffering, Europe is going to suffer when it comes to an infectious disease. You cannot look at the UK and say, oh, you're doing poorly now. Europe is going to be next, because the world is open. I mean, we're not just locked countries. We're not islands. And this vision sometimes is what is lacking. And I think it's dangerous when it comes to pandemics.
I remember years ago, the former Secretary General of the United Nations, Kofi Annan, said that an international pandemic is only a plane ride away from any particular country, because you cannot stop flights, you cannot shut commerce down, you can't do all that, close your borders off. It does not work. It has never worked, and it certainly won't work as we go into the well into the 21st century. Well, you're watching Global Connections Television, which is a privately funded, independently produced program. The opinions expressed on Global Connections are solely those of the moderator and his guests. We'd invite our viewers to go to our website at www.globalconnectionstelevision.com to view previous programs. Also, if you're involved with a PBS or community access television station, or perhaps an intra-campus television hookup with an educational institution, or you have a podcast, or you just have a computer and you like our shows and you would like to share them, please feel free to do so. Global Connections Television is provided at no cost as a public service to help us better understand international issues and how they impact our lives. Today, we're talking about the COVID-19, which has been on the front pages of every newspaper in the world for at least the last year, almost a year and a half. And my guest today is an expert on this topic. Dr. Salvador Macip is a doctor, researcher, and writer. Dr. Macip is the head of Mechanisms of Aging and Cancer Lab at the University of Leicester in the UK. And his latest book, out of dozens, is Modern Epidemics from the Spanish Flu to COVID-19. Dr. Macip, we were talking about a variety of factors. One that we didn't mention earlier, and let me ask you, it seems like any topic we talk about today, we have to fold in climate change. It affects everything we do. We can't get away from it. It seems like, is climate change affecting these pandemics and maybe helping to create more of them or make them more dangerous or more deadly than they have been in the past?
Absolutely. That's a very important thing, because when we talk about our ecological crisis and the problems of global health, as it's known, we always think about just the increase in the temperatures and how the climate change is going to affect the temperatures and melt the ice caps and all that. But it's farther richer than that. I mean, the fact that the changes in temperatures is changing also the habitats of the animals, and the way we interact with them is very important. So that I think we live in the 21st century now. We live in sort of a perfect storm kind of scenario where we are in a situation in which, as you were saying before, the pandemic spread really quickly because of a few reasons. First of all, our ability to move around the planet like very quickly. I mean, we're just taking planes and just moving around like never before. So anything that happens in any corner of the world is potentially a worldwide problem, something that maybe last century wasn't exactly like this. And together with that is the fact that climate change is going to destroy habitats. It's going to make animals move to other habitats. We're seeing now, for instance, mosquitoes in places where you wouldn't see it before, and you see tropical diseases or the diseases, infectious diseases that used to be more tropical. Now they are expanding their reach into what used to be not so much tropical places. This is happening because of that, because our interaction with the environment is affecting not only the climate, but also the rate of infectious diseases. So we live now in a moment in which we should expect these sort of things, epidemics and outbreaks and pandemics more often than in any other century because of that, because of this, our ability to move and the way we are influencing and destroying and interacting with the different habitats of these animals.
And as we move through this, there's a lot of discussion still going on, and the scientists have been discovering new information every day. It seems like what they thought might have worked a year ago, they're saying today, well, maybe we shouldn't be doing as much of that, or maybe we should be doing some other things. But the impact has just been absolutely incredibly bad on countries all around the world. And we do see now that the developed countries, economically developed countries, are starting to move out of it more, but the developing countries, they're actually getting worse, are they not? It's the situation's deteriorating in most of the economically developing countries.
Yeah, and I think this sort of debate between economy and health has been around a lot this year. I think it's been put up front much more than normal. I mean, even with during the Trump administration, you could see that a lot of decisions were made from the economical point of view and not from the actual health point of view. Which you can argue, you can discuss what's more important for a country, whether to be alive or to be economically viable. I mean, both things are obviously, you cannot separate. I think the problem is to look at these two things as separate entities. Economy and health go together. If you don't have economy, you don't have health. If you have health, you don't have economy. This needs to be looked at together. But these are sort of these decisions that are being made solely, purely based on let's protect the economy of our country. They're affecting the planet, and then they're going to go back to you. And actually, everything is going to go wrong. The health and also economy is going to be hit. And many decisions during the pandemic, it's been like, okay, let's keep everything open so our businesses can work. Our bars are open, our clubs are open, restaurants are open because they need the money. But yet, as you leave them open, the virus spreads faster. People get they get infected, and then we would have to close them and for longer. So in the end, the economy is not safe at all. And this studies proving this, and there's data on this on countries that did perhaps a more stringent sort of lockdown, and those that were more relaxed. And in the end, Sweden was one of the examples. In the end, this was a problem as well. When you were trying to save the economy, it didn't work because in the end, it came back to you. So I think that's perhaps one of the lessons we need to learn from this is that you cannot separate both things. You need to understand it from the perspective, like together, how you save the economy as you save the health and all the things at the same time. And I think in certain countries, there's been also perhaps a lack of protection of these people that were suffering more the economic impact of the pandemics. Obviously, there's certain businesses that were suffering more. So the governments should have found a way to actually keep this business afloat, or just to give them some sort of life-saving donation or something to keep them afloat. And that's something that some countries were not doing properly. And I guess, again, it's something that it would be easier to see in hindsight than just after a few years, perhaps after the pandemic, we will analyze this and we say, okay, we did it very wrong here. So this didn't work. So let's try to improve it next time.
That is so extremely important. And that was one of the problems, excuse me, that we ran into in the United States. We have 4% of the world population, yet we had 25% of the deaths and the afflictions in this country. And one of the main reasons was because of the knee-jerk, really just counterproductive activities of mostly people in government, to come right down to it. You had some governors who wanted to close down. Nobody wanted to close down, but they did it because they felt like they had to. Then you had other governors who wanted to keep businesses open or whatever activities underway. But then in the White House, we had this problem. President Trump, who actually told Bob Woodward in March in an interview that this was a lethal disease. It would kill you. It was airborne. He's on audio tape saying this. And then for months and months and months, he denied it was even happening. And so then you had the media, the right-wing media running along saying, well, this is really a hoax. It'll disappear. It'll be gone by Easter, that type of thing. And it was just misinformation piled on more misinformation and disinformation. And ultimately we see now we have what, close to 600,000 people who have died in the United States, but it was really governmental malpractice. And that's why when
Absolutely.
most people look at what happened in the United States and in Mexico and Brazil, they say it was just one blunder after another, just one level of incompetence after another. And that it's just really tragic. But that's one of the problems that we're going to have to encounter in the future. And I'll just mention one thing, just throw this out while we're talking about how the media play a role. Right now, we see that probably one of the most knowledgeable people in this country is Dr. Anthony Fauci. And he is being maligned every day by right-wing media, radio talk shows, the Fox, One America News, different ones like that, trying to blame him for this pandemic, which he had very little control over. In fact, when he would make recommendations to President Trump ignored him. He was out here talking about hydroxychloroquine, ingesting bleach, that type of thing. The media are just absolute, or a large part of them, not all of them, but a large part of them are absolutely irresponsible and they're unethical. Have you seen any other country that has had this type of approach to dealing with this type of disease? I know you see a lot of different countries, but I've been curious, are we the only one afflicted with this really pathetic media to some degree that we have?
I think I haven't seen anything like this in other places as much. I mean, I think everywhere there's been a bit of both things. I mean, I think I agree with you that this is exactly what was happening, but I think it's fair also to remark that there were other media in your country that were doing an excellent job. I mean, the New York Times, for instance, has been at the forefront of, I mean, it's been a reference from everybody else in the world. So I think it's been this sort of a balance of really bad media and some really good ones. I mean, how do we deal then with the bad ones? How we can make sure that they're not the voices that are most heard? I think that's a problem. And I think the problem in the US is that it's so polarized politically in that sense. And it's been, I think in the past 4 years, this divide has increased in the country. I mean, all countries have different sides, but it's been more polarized because of the way President Trump was dealing with these things. And that, I think, reverberates in the media as well. And the media is taking a very extreme position in these things. And I think it should be separated, politics from health issues. I mean, you cannot mix this. And I think it comes back to what you were saying before. How do we avoid the problem that a leader like President Trump or Bolsonaro or other presidents cause in a country? Because this is, again, is paid in lives. I mean, I understand that you cannot expect a president to know everything about everything. That's fair. But the president has to be able to listen to the experts and follow the recommendation of the experts. And seeing Donald Trump constantly not following what Dr. Fauci, which I think, again, it was a worldwide reference, that what he was saying was normally views on the pandemic, and listening and not listening to him, basically, not taking his opinion in consideration when making decisions on national politics. I think that's a problem. So there should be some sort of a mechanism of like a sort of an expert body that every president, even the most inept and the most incompetent one, could go to that organism and say, okay, you are the experts, tell me what to do, or what is the more rational thing to do here. And I think that perhaps it's missing. And when it becomes a matter of politics, and if I'm saying this and you're saying the opposite is because you don't agree politically with me, that is a problem, because we have to be able to separate that. See, if I'm not agreeing with you, it may not be because of the politics, it's just because you're not right or because you're not an expert on this. And how we manage to separate these two things, politics and science or health decisions, I think it's one of the homework that we need to work on, because it's not been only in the US. I think probably the US is where you've seen the most extreme this sort of separation, but you could see it in many countries, even in the UK, even in Spain, where the central government was fighting with the local governments on political grounds. So the central government was saying, let's do this, then the local government would say, no, let's do the opposite because we are against you politically. You cannot afford this. I mean, the citizens cannot live in that sort of situation because in the end, you are going to suffer that. You are going to be dying because of this incompetence of leaders.
Well, that's right. Several 100,000 people died because a lot of people are saying because of the incompetence of the U.S. government in many respects. But Dr. Salvador Macip, it's a fascinating topic. And as you mentioned, we will have another pandemic. We know it's coming, and now we have to prepare for it. We have to strengthen the World Health Organization. We have to hopefully get our media aligned to the point where some of them can tell the truth about what's happening, but it is a topic that we're going to have to confront. But I want to thank you so very much for a very interesting and a very informative program today.
It's been a pleasure.
Thank you. I'm Bill Miller. Thank you for joining us today on Global Connections Television.